Well, hey, everybody, I'm Raj Kumar, President and Editor-in-Chief of DevX. Really delighted to be with all of you who are joining us on platforms from all over the world. Really great to be with you. And really what we're doing today is kind of opening up our newsroom and some of the incredible journalists we have here at DevX covering global health to all of you. Just kind of give you a sneak peek inside the conversations we have, and especially leading up to our big moment on Thursday, Prescription for Progress. You'll hear more about that in a minute. But first, maybe we can just go around and introduce ourselves so everybody knows who all is here. I'm just going to kind of call you out based on where I see you on the screen. Jenny.
Hi, yes, I'm Jenny Ravelos. I'm Global Health Reporter for DevX.
Everybody knows your byline by now if they're following global health coverage. You're based in Manila in the Philippines.
I'm based in Manila, Philippines, but I cover global health sector.
And Catherine.
Hey, I'm Catherine Cheney, and I am our West Coast correspondent at DevX based in California. So I cover the role of the West Coast of the United States in global health and international development, including the Gates Foundation, tech companies, philanthropy, obviously a big presence out here. And I've been working very hard on the Prescription for Progress event Raj just mentioned.
Yeah, we're going to be going to you a lot on that because this is Catherine's baby, her brainchild. She puts a lot of effort into it every year. Rumbi.
Hi, everyone. My name is Rumbi. I'm the associate editor based in Africa, based in Botswana particularly.
Great to have you here, Rumbi. And Amrita.
So I cover all things Africa.
Yes, all things Africa and a lot of global health. We've seen your reporting on Africa CDC, recent report. We'll get into in a minute some of the stuff that you've covered. But Amrita, let's hear from you.
Hi, everyone. I'm Amrita Adyatnal. I'm an associate editor at DevX. I'm based in Delhi, and I am the editor for the Asia region. So I work with Jenny, who's our excellent health reporter, and a couple of other reporters who are also from here. And I'm really excited to be here. Thank you, Raj.
Yeah, well, great to be with everybody and joining from all kinds of different time zones from very early in the morning till quite late in the evening. So thank you all for doing that. So maybe before we get into Prescription for Progress, we can just dive a little bit into kind of the moment we're in now. We're getting near the 1-year anniversary of declaring COVID global pandemic. And there's a lot happening on the COVID story, a lot happening in our space, right? Because I feel like there's been obviously an unprecedented amount of attention and coverage on the pandemic, but so much of it has been focused on what's happening in rich countries, where a lot of the deaths are, of course, where a lot of the hardest impact has been. But there's been a real dearth of it in the lowest income and fragile countries, and that's starting to change because the picture's starting to change a bit. Maybe I can turn to you, Jenny, to kind of give your sense of where we are right now. And you even had a story out today about the ACT Accelerator you might want to mention.
Yep, thank you for the question, Raj. So there's actually a lot happening in global health. So one of the things I'd say is global cases, when you look at the numbers, are falling, including deaths. But you have to look individually in countries to actually see that it's not actually the case individually. You're seeing countries such as the Philippines, for instance, we're still seeing a rise in cases. There are countries where you see, in Southeast Asia, for instance, Cambodia, where there's now another local transmission happening. So it's difficult to just look and say, okay, global cases are falling, but we have to look what's happening in low and middle income countries. Another thing, and you mentioned about my piece today, actually I've spoken to Dr. Bruce Aylward from WHO. And the main point of that story was really asking him, what's the game plan for ACTA? Because this global platform has been there since April 2020. They had a 38 billion target for funding. Before the G7 meeting last week, it was just $6 billion
that they raised.
So that they had, and now they were able to raise an additional 4.3 billion from the meeting last week. But still, it's almost 23 billion funding gap at the moment. And essentially,
this is to fund, just for people who aren't as familiar with, this is to fund diagnostics, therapeutics, and vaccines, yes, basically, right?
Yeah, essentially
to countries that can't afford it themselves.
Yeah, so essentially the first focus was to develop these tools, to combat COVID, but now it's shifting. The focus is shifting to optimize, the use of these tools to deliver them to countries. But that's where the constraint is happening because of the scarcity in resources. And so, Dr. Aylward was essentially saying everything just moves slower. That's the bottom line. That's what he's telling us last week.
Yep. Well, I think a lot of these are things we're going to get into in Prescription for Progress, thinking about both where the kind of institutions and funding meet with new approaches and new technologies and how we get there. But maybe Rumbi, I can turn to you as well to think about, you're based in Botswana. That's one of the countries that is seeing a rise, right? While the overall case count is down, things in Botswana are getting worse, and in several other countries in the region. What do you see the picture as right now? Maybe you can tell us a little bit about some of the reporting you've done recently.
So initially, when the pandemic hit, there was a big worry about Africa that health systems wouldn't be able to sustain this. And we had a relatively good year in 2020. It looked like the worst was behind us. Then the second wave hit. So that's what we're currently going through right now in Botswana. We're seeing a rise in cases in so many African countries, mainly because of the second wave, and also possibly because of the spread of the variant that was first detected in South Africa, which people are saying spreads quicker. And yeah, so we're seeing quite a rise in cases. So there was a lot of talk as well about health systems in Africa being unable to cope. And the second wave is really putting a strain on that. I think one of the stories that I worked on recently was speaking about how we're seeing a lot of deaths within the elite. These are African ministers, heads of government, and we're seeing a lot of deaths within that group. And many health people that I'm speaking to are saying this is an indication that systems are failing, the systems are overwhelmed, but there's also a hope that this will sort of result in more investments in terms of health systems within countries. So I spoke to people in Malawi, in Zimbabwe, and in Malawi, they're sort of seeing that shift, that sort of recognition that we have to invest in our own systems. In Zimbabwe, not so optimistic about it, but I think an interesting update which came over the weekend is that in Tanzania, and this is a country that has essentially said we don't have COVID. There is no COVID in Tanzania, and they're not reporting any cases. But we had a vice president in Zanzibar, which is an independent part of Tanzania. We had a vice president dying from COVID from there. So we are hoping that these deaths will also highlight the need to invest and also be realistic about COVID-19.
Yeah, I was struck by your piece in part because I remember a couple of years ago, I interviewed South Africa's health minister at the time at the UN General Assembly. And he made a similar point that, one day in the future, we should be at the point where African ministers like myself would get our care locally, because it's known that so many elites go overseas for care. They're going to India or they're going to Europe or somewhere else, right? And so your piece made it clear, because of COVID restrictions, people can't travel, even elites. And so they're forced to use their local hospital, which may not be up to.
They're forced to use their local hospital, and they're forced to confront all the things that they were able to ignore before COVID-19. So that could be eye-opening.
Yeah, well, you also started to get into another story that I know we're looking at and it's getting a lot of attention, the South Africa variant. I think it's 501 something, B2 variant of the disease, which the AstraZeneca Oxford vaccine may not be effective against. And so there's a lot of question now. South Africa's government said we're going to pause on giving out that vaccine. Africa CDC says other countries can go forward with it, but it's really a key moment here of trying to figure out what are we going to do on that. And there's a lot. I mean, vaccines is probably the big story of the moment. And Amruta, I know that's something you've been looking at as an editor. Do you want to chime in on this story from your vantage point?
Yeah, absolutely, Raj. This is something that, we've sort of tried to explore different angles of. And currently we're looking at what is the state of vaccine diplomacy. Earlier in the year, we were seeing, sort of rich countries trying to give away vaccines to the poor. There's also obviously a sense of, greed, where richer countries are amassing more vaccines than they actually need, while poor countries haven't even started any vaccination drives yet. One interesting story from the region is of Pakistan. Pakistan, as you know, doesn't have much capacity to produce its own vaccine, and it will rely on other countries and COVAX for its immunization drive. And India, in a show of vaccine diplomacy, has given away vaccines for free for a lot of its neighbors, but it has excluded Pakistan. So a story that we will see in the next week or so is exactly about that, how Pakistan, as a low and middle income country, is coping with this situation that it finds itself in, where it has to rely on other countries, on this complex COVAX mechanism, which still hasn't delivered any vaccines to countries yet. and how the internal process looks like as well. Of course, as you know, in Pakistan there is a sense of vaccine hesitancy historically with the polio vaccine. So in countries like Pakistan and Bangladesh, in the Southeast Asia region, I think we'll sort of see an interesting sort of picture unfold over the next weeks and months, where we'll see health workers really trying their best to get the vaccine to the people who need them. And then we'll see in real time how this is done, right? We'll see, what vaccine hesitancy looks like and what sort of the biggest immunization drive that the world has ever seen can look like in some of these really poor, resource poor nations.
Yeah, and you mentioned COVAX, and of course we talked about the ACT Accelerator. This is like the moment of partnerships, right? We've got everything from CEPI, which was stood up after Ebola, and it's the backer of multiple of the main vaccine candidates that we're seeing now that actually moved into production. I think they backed something like a couple of hundred total vaccine candidates here. You've got Gavi, which is the implementing arm of COVAX, right? They're developing or designing the distribution systems and doing the purchase agreements. You've got, of course, the WHO. You've got so many global partnerships that are engaged in this, the Global Fund, and that's maybe a new lens on what's happening in the global health space. Like, yes, there is country-to-country diplomacy, like India, Pakistan, as you just described, but these are big players now, the partners, and the private corporates that are in the space, et cetera. And that's a lot of what we're going to get into in Prescription for Progress, Catherine. Maybe you can just give your sense of how the moment and Prescription for Progress sort of connect.
Absolutely. Well, I feel like it'd be helpful to provide a bit of context on the rationale for this event and how it's now more relevant than ever. So when we first organized this event, it was in person in San Francisco. And this is the third iteration of Prescription for Progress. But the idea was, the tech sector and many philanthropists are deeply engaged in global health, but they don't really consider themselves global health professionals per se. And they wouldn't show up to a lot of the convenings where global health conversations happen. So how can we bring together these new emerging actors and, the more traditional global health actors, NGOs, health ministries, donors, et cetera. So it's crazy thinking back to a year ago, February 20th, 2020, we were together in San Francisco. It was the last trip many of us would take. And we talked on stage about the coronavirus and how partnerships would be essential. And just looking over the past year, I mean, what's really been hard in pulling this event together is what kinds of partnerships do we highlight? In this Prescription for Progress event, we want to highlight partnerships with lessons that others can learn from. And there is just so much global health partnership going on, as Raj said. So what I've really tried to do is just understand from people what's exciting that can offer lessons to others. I'll give a couple examples. One is the role of technology in COVID-19 response specifically. So one company you may not have heard of that could be an interesting one to watch is Kinsa. Kinsa is a connected thermometer company. I use one of their thermometers for my baby boy. But actually, the founder and CEO of Kinsa, his larger goal is to build an early warning system for disease. They saw spikes in temperatures across the US ahead of knowing what it was. They thought something's weird here, and it ended up being COVID-19. Actors like that, with this kind of data at their fingertips and connected devices in homes across the country and around the world, should be part of the conversation as we prepare for future pandemics.
It reminds me of Google's early flu tracker, right? Where you could like type in, they would just see how many searches are happening for the sort of symptoms that you typically comprise flu, and they could use that to sort of track where's it going and how bad is it. And you're right, there's so many more sources of data now that can help us to predict where things are coming from. And especially with the number of new, zoonotic diseases jumping over to humans that could come in the years to come, we need those tools. Absolutely.
That's a big, important point when you mention zoonotic diseases. I think another critical question is not just partnerships between tech and philanthropy and the traditional global health community, but partnerships between people working on human, animal, and planetary health, because the origins of a lot of these diseases are not only from animals, but due to the fact that humans are destroying the environment in such a way that it's putting humans and animals in closer contact with each other, leading to new disease threats. So we'll hear from leaders in planetary health and in One Health about some opportunities for collaboration there. And I think one thing I just wanted to note when Raj was mentioning, CEPI and some of these other organizations that are convening actors all over the world on global health, that's an important goal for me with this event, is not just a bunch of Silicon Valley people talking with each other, but bringing them together with more traditional global health actors. So we will have representatives from ministries of health. We'll have a representative from UNICEF, which is very involved in actually getting vaccines out to people in low and middle income countries. He'll be sitting alongside the CEO of KINSA, a representative from the Gates Foundation, a representative from Babylon Health, talking about some of their work in Rwanda. So you have people who don't always come together in conversation about this moment we're in, which I think, is a real, hopefully, turning point to understand how to leverage these lessons moving forward. One thing I've heard, and I'm sure you all have heard this in your reporting, I'd love to hear your thoughts, is there's a fear that when we come out of this, people will just want to move on. Like, let's just move on. And that will turn into complacency versus really reflecting and leveraging these lessons moving forward.
Yeah, if this doesn't do it, I don't know what else would, right? To get people to say we need a different health system. We can't leave 50% of the world without basic, access to basic essential medicine. But I do remember, sitting with you in the Bay Area, no masks, crammed in. I think it was the last big event that we held at DevX in person. And now when you say everyone's going to be side by side, of course, see how much things have shifted. They'll be side by side virtually on the screen with all of us.
Yep, that's right. It's crazy to think back.
It is. Anybody want to cue off of what they just heard? Go ahead, Amrita.
Yeah, I think so. Speaking of, when we emerge from this, what will really change? A few conversations that I've been having over the last year really have been about, this idea of decolonizing global health and what is COVID as a moment really sort of teaching us. Is it, sort of magnifying the fissures in our community, in the global health community, in the larger international aid community, or if it's actually making people realize what the gaps were and sort of helping people step in. But, that's something that people fear as well, that, because of sort of the gravity of this moment, we will emerge from this and things will just go back to square one without really us addressing what needs to change and especially given sort of the inequity around access to medicine, access to vaccines. People are also fearing that this will lead to more inequity going forward. If vaccine passports become a thing, then people who haven't been vaccinated yet will get less and less access to, spaces, to opportunities to really travel and conduct their research and conduct programs. So yeah, that's something that, we'll continue to explore in our reporting as well.
Anybody else? I'll just mention that, I think it's going to be pretty stark for all of us. It's going to be visceral in a way because we're all out there trying to get our own vaccines, right? And we're thinking about it for ourselves, our families. But yet, even like within DevX, within our group, all of us are in different countries, a couple of us in the same place in the US, but we're going to have very different timelines for when we have access to it. And if you look even across like the people who would attend a DevX event, a global health event like Prescription for Progress, come from all over the world. Everyone's going to have very different access to this. So suddenly it does put in really stark relief. This is a pandemic, right? It affects every country. And yet our system is so, fragmented. It's so divided. It's so based on these old historical structures and iniquities. And it's going to be really visceral, I think, for all of us and for the organizations we work with and cover, right? That are global in nature, that have staff all over the world. And that have to somehow address this in a way. I agree. It's a big thing now that's hopefully hopefully a moment of introspection and change. Let's say. What do you think, Rumbi?
I think like what you said is spot on. If this doesn't change things, then I don't know what will. But then if you're looking at the state of affairs right now, it's a bit questionable if we're actually going to see any change. Like if you look at Africa right now, we only have 8 countries that have started rolling out vaccines, and we're not talking in the millions. We're talking about people who maybe have 200,000 doses of vaccines. We're expecting a larger number to come in this week, hopefully through COVAX. But then if you look at it, we only have 8 countries that have started rolling out vaccines. I think that says a lot.
It sure does. It sure does.
One thing I'd share just from some recent conversations I've had, and you all may have had similar conversations. I think we're also just learning a lot of these issues are more complicated than originally thought. So in a recent conversation about vaccines, what came up is it's not just about funding, it's not just about distribution, it's about trust. And you have a lot of global health actors who are not necessarily set up to tackle issues of trust, which is forcing them or leading them to partner with people who are in that position. And one of the really interesting conversations we're going to have at Prescription for Progress that Raj will be leading is a conversation with Peter Piot and Heidi Larson, who are an amazing global health power couple doing fantastic work with really complementary skill sets. Peter is a renowned microbiologist who's worked on Ebola and HIV/AIDS and COVID-19 now. And Heidi Larson works, she leads something called the Vaccine Confidence Project. So she's working on trust. Then you have actors like Facebook, who will also be represented at Prescription for Progress. Huge opportunities for partnership there to potentially build trust, and yet also part of the problem. Social media is a huge source of vaccine disinformation. So I think the issue of trust is very complicated and is stumping a lot of actors in global health, but can also help to drive partnerships in a really interesting way.
Yeah, I can't help but think, so many pharmaceutical companies I've talked to and covered and interviewed over the years, right? And I think historically they viewed their work as, well, we're the innovators, we're the scientists, we're going to develop this incredible new technology, a vaccine, a drug, and then our job is done. Like, we've done our part, right? And then of course there are patients who need it. And so somehow this will happen. Patients will get that medicine. And whether it was that the pricing was really for rich countries, or there weren't the distribution systems, or there's a lack of trust, whatever it was, there are so many countless examples of the medicine actually existing and yet not getting to the people who need it most. And what's been required are massive popular movements. Think of the AIDS movement, of people everywhere, really protesting and putting their lives on the line to shift these systems. And then I think pharmaceutical companies have woken up from all that and said, no, part of our job now, especially in global health, is to connect the dots, through the supply chain. Maybe we have to train health workers, and maybe we have to, do capacity building in countries. And we really have to do partnerships. We have to do all this stuff that's way outside the laboratory. And I think one of the lessons maybe that's going to come out of this, which I think we'll be talking about this week on Thursday, is what are kind of the new lessons that are going to extend the way we think about access to medicine? And I think there are going to be some new ones, and it's going to include things like social media and trust.
Mm-hmm. You talk about trust, and just to add, it's interesting because that's one of the things that's really a constraint in the rollout of vaccines in a lot of these LMICs. Just an example is in Indonesia. So they came out with a presidential order saying if you refuse the COVID vaccines, you either don't get your social assistance, or you get fined for not getting your vaccines. You get all these kinds of issues wherein at the global level people are talking about, we need to get those vaccines now in countries, but in countries the challenge is that a lot of people have this thought of whether they would want to get the vaccines really because of, you mentioned about disinformation, but there's just also the kind of communication happening at the global level, whether that's, whether the people truly understand, how these vaccines work and how they were developed.
Yeah, the US might be a sort of test case for this because vaccine rollout is happening fairly quickly here, certainly compared to the global standard. And we might get to the point soon where there's enough vaccine for Americans who want it. And then there's more vaccine than we need because a lot of people won't take it, right? That could very well happen here, even in the spring. And that'll be a real sort of test case or a moment, of clarity when you look at other countries saying, we need the supply. And the US may be saying, well, we don't have enough demand. It's a crazy situation to imagine being in, but you can find examples like this, really strange examples across disease areas where the drugs exist. The therapies exist, the money exists, it's just not connected. And that's where I think these partnerships are so key. And one of the things I'll be listening for on Thursday, because I've talked to a bunch of people in this space, and I get the sense the same way CEPI came out of Ebola, I think there will be some new big, global health architecture shifts post-COVID. and some new thinking post-COVID, and maybe some new splashy partnerships, some of which might just be a lot of attention, but nothing comes of it, and some which might be really real and substantive.
It's definitely a space to watch. I know one of the groups we'll be hearing from at Prescription for Progress is the Trinity Challenge, which is bringing together actors primarily working on data to prepare for future pandemics. But Raj, I've heard you pose this question to Mark Sussman at the Gates Foundation. The Gates Foundation has been a very influential actor behind Gavi, CEPI, the Africa CDC,
Global Fund,
the Global Fund. And I haven't heard him articulate what might come next, but I'm sure those conversations are happening. It's definitely a space to watch.
Absolutely.
Or how to further strengthen those institutions that do exist already.
So we're kind of coming up on time here. I wonder if anybody has some last thoughts, anything that they're looking forward to, or that they just want to alert our audience to.
I'll just say one thing that we'll...
Go ahead, Amrita, then we'll come to you, Rumi. Go ahead, Amrita.
Okay, yeah. This one thing that we will keep our eyes on, and I know our reporters are working hard on, is sort of looking at the next frontier. Once we get through this idea of vaccine diplomacy and, countries and their access to vaccine itself, what we'll come to next is how disadvantaged groups within countries are given access to the vaccine, and how, sort of that next step is rolled out. And, we have, again, like a variation of those groups across the world. We'll be looking at each sort of one of those individually, and we'll be looking at the broader picture of, again, what lessons that we can take away from this into the next crises. So yeah, that's something that I'll be watching on.
Great, looking forward to that. Go ahead, Ruby.
So from our region, the vaccine rollouts are only just beginning. This week, we're expecting 1 million vaccines, and that's through a partnership, which is really great to see. One of the biggest cell phone companies in Africa donated some money to Africa CDC, so we're expecting 1 million vaccines from that. And then we're also expecting some AstraZeneca through COVAX to start coming through now that it's received WHO emergency approval. So we're expecting those vaccines to roll out. But I think a thing to look out for is variants and vaccines. What's going to happen in that space? Like you mentioned earlier, Raj, South Africa has halted the spread of AstraZeneca, and we're expecting quite a lot of doses of AstraZeneca to reach the African continent. So it'll be very interesting to see what's going to happen in terms of that rollout. And it's also going to be interesting to see how that will also affect vaccine hesitancy.
I agree completely. It's such a strange situation where, even average patients might know the name of the vaccine they have access to. They might, be looking at the difference in what they think are the effectiveness rates of them. You have different countries pushing their vaccines. So there's a lot here to follow. And I think it's not totally clear how the whole thing will shake out in the end. The one hope I have is that, you mentioned Africa CDC. That's a relatively new institution, and you can see what key role it's playing. And I think that maybe we will get some of those lessons out of this crisis that will help better prepare for the next one. Jenny, some last thoughts from you, and then we'll close with you, Catherine.
Yeah, just to say that, apart from what Amrita mentioned, we're going to be looking next to, the inequities happening within countries as the vaccines are being rolled out. But also, for me, I'm also looking at the role of being played by China and Russia with their vaccines, how that's being rolled out, where are these vaccines going? So that's something that's coming from me in the coming weeks.
A lot in the Philippines, I think, right? The Chinese vaccine, I believe, is at least that's part of the plan, no?
Let me just add something that's really funny that happened today. So the Philippines just gave emergency use authorization to the Sinovac vaccine today. And something happened because the health minister said, we haven't given emergency use approval to the vaccine. 5 minutes later, the regulatory chief of the Philippines says, oh, actually, we've actually just given regulatory approval to the vaccine today. And so, but the thing is, the recommendation is for it not to be used for healthcare workers and for people aged 60 and older. So the question now that we have is, who's going to get the vaccine if the high risk groups that are meant to be getting it are not going to be getting it? So yeah.
Yeah, that's a fascinating story. And there's going to be a lot like that. This is just the beginning for many of the low income and middle income countries. So we'll be on that here at DevX. I really appreciate all of your reporting on it. Catherine, it's coming up Thursday, just a couple days away, the big event. How do people join it if they want to be a part of it?
Yeah, absolutely. So if you just look up, and I'm sure there's a way we can share around this either live streaming or recording. If you look up Prescription for Progress, you should be able to register there. You can look through the speakers and the agenda. We have some content that will be exclusive to our DevX Pro members, but a lot of the event is available for any of you to tune into. And one thing I just wanted to really reiterate is I know there's Zoom fatigue. People are just kind of tired of all the online events and online content. One thing we've been really mindful of in the Prescription for Progress agenda this year and in years past is not just to talk about issues or call for what's needed, but to highlight best practices on the virtual stage. So I really think the day will be full of lessons. And the other thing I want to note is Prescription for Progress is a full day on Thursday. The time zone is 8 to noon Pacific, but you can catch the recording later if that timing doesn't work for you. And I also just want to mention these conversations will continue. We'll have events building on Prescription for Progress, as well as content building on Prescription for Progress that really looks at the role of partnerships, best practices, lessons others can learn from moving forward. So we hope you'll join us for these events. And if you have stories that you think we should be considering, whether for our coverage or for upcoming events building on Prescription for Progress, partnerships that you're involved in that you think might offer lessons for others, please be in touch.
Yeah, follow our incredible team here on Twitter. Tweet at us, tell us what stories are out there that we should know. And I will mention, I'm kind of sad not to be in San Francisco for this event and not to see you, Catherine, and my colleagues and all the great people who show up. But it is kind of cool to be able to open this up to a broader audience around the world. Wherever you are, you're going to get to hear from people who are really steeped in that Silicon Valley world, plus people who come from the global health community. So it's kind of a unique and important event that you don't want to miss. So thanks to all of you for this conversation today. It's been great. And thanks to everyone who's been watching.
Thank you.
Thank you, Raj.
Thank you.